Good morning, everyone. My name is Samantha Mott. I'm the Public Information Officer with Sacramento County Public Health. Welcome to the resumed public health media briefings. As I said in my email yesterday, these will be on an ad hoc basis. So if there's a particular topic that we're seeing on repeat in the COVID inbox, or we feel like there's something that really we need to give you all the opportunity to ask public health questions and brief you all on where we're at. We will have the briefings on Thursdays at 10 o'clock. If we're going to have one, you can expect an email by Wednesday morning. It'll be almost the exact email I sent yesterday with the Zoom link. And just a reminder that the briefing will take place on Thursday morning. With that, I'm going to hand it over to the Public Health Officer, Dr. Kassirier, to update you on where we're at.
Good morning, everyone, and thank you for joining us. So with the numbers, we are now at 109,517 cases reported to Sacramento County and 1,750 deaths. Our 7-day average is about 110 cases on a daily basis. So the numbers are going up from the time that we had our last update. The case rate is at 7 per 100,000. So again, the case rate has increased as well. We are working with the Capitol on an outbreak among the staff, and we have been providing them with some recommendations, such as requiring masks for everybody regardless of their vaccine status. These are recommendations that are already in the Cal OSHA guidance for how to handle an outbreak. With that, I am going to turn it over to Jamie White to give an update on the variants.
Hey, good morning. So as a reminder, the CDC classifies a variant as a variant of concern based on evidence that it's either has an increased ability to spread from person to person, and or there's a possibility that it has a reduced effectiveness for treatment or reduced immunity based, whether that's immunity from convalescence or from vaccination. So the Delta variant is one of many variants of concern. Right now, the Alpha and Epsilon are still the most commonly circulating locally. However, we are seeing more and more of the Delta variant. Currently, we have 75 cases of the Delta variant that we've been notified of. And we expect that it'll become the most commonly circulating variant locally by the end of the summer. Another reminder about the variants is that these are for surveillance purposes, not for diagnostic purposes. So if you go and get tested for COVID, that does not necessarily mean that you'll be tested for which variant it is. Not all specimens are tested or genotyped to see what variant they are. And it's also not necessarily a random sampling. So the state lab is doing any testing for our county. Our local lab is not doing the variant testing. And the state lab is prioritizing outbreaks, cases among vaccinated persons. And I feel like there's one other area that they're prioritizing.
Hospitalized.
Thank you. Yes, and hospitalized cases. So, so with that in mind, we have to interpret with caution any trends that we're seeing in terms of demographics among them, since it is not necessarily a representative sample of all of the cases in the county. And then another reminder for everybody is that vaccination, regardless of the variant, is still our #1 defense and most effective way to prevent disease. And a lot of the vaccine manufacturers are now coming out with some data and statistics around their effectiveness level for different variants. That's all that I have. Sam?
So with that, I will open it up for questions. Please use the hand raise emoji if you have a question, or if that's not accessible to you, please type your question in the chat. Chelsea Shannon, go ahead and ask your question.
Hi, this is Chelsea Shannon with ABC 10. I wanted to know if the rise in cases that we're seeing is kind of what we expected with the reopening and people loosening up.
Yes, we did expect an uptick in numbers after the opening on June 15th. But I think the concern we have right now is with the increase in cases that are genotyped as the Delta variant, because the Delta variant we know is more contagious. And so we do have concerns, especially for areas or communities where the vaccination rate is still low.
Michael, go ahead, ask your question.
Hi, it's Mike McGough, the SAC. The state's dashboard is showing Sacramento County's hospitalizations increased pretty quickly from 60, I think, 2 days ago to 75 yesterday to showing 90 this morning, 91. Do you know if that's been influenced anyway by the 4th of July holiday, or are those accurate? And if so, is that a concerning increase?
I think it would be too early to tell right now if it's from the 4th of July increase. I don't think we'll have that information for another couple weeks. I would say if it's tied to anything, it's more the reopening. Dr. Kasiri, do you have anything additional to add?
Correct.
Anybody else have a question?
I do have a second question that I just thought of.
Go for it.
Do we have any sense of, just to give perspective on the 75 cases of the Delta variant, do we know how many cases that's out of that have been sequenced, or what percentage of positive cases are being sequenced?
So I don't have that specific. Oh, go ahead, Dr. K.
At the state level, it's about 10 to 15%. We do not have the exact percentage at the county level, but the ones that are selected for genotyping are those that are hospitalized, breakthrough cases, and also cases in outbreaks.
Okay, questions going once, going twice? Brandy?
Yes,
Go
Dr.
ahead.
K, do you have any increased concerns about those breakthrough cases, noticing that those numbers have gone up as well on the county dashboard?
So the breakthrough cases are cases that occur in people who are fully vaccinated. We know that the vaccines that we have are very effective, but they're not, of course, 100%. So it is expected that we will get some breakthrough cases. But in general, when you look at the numbers, they're very low. And at the state level, when you compare the case rate among people who are vaccinated, it's like 0.4 compared to about 3.9 for the unvaccinated. So again, the vaccine is the best protection that we have.
And I would just remind everyone that on our dashboard, we have two different metrics. So breakthrough cases are defined as ones that are symptomatic per the CDC and state definitions. We have those numbers, but we also have cases regardless of symptoms among all vaccinated persons, which is obviously a higher number than technical breakthrough cases.
Chelsea?
Can you hear me? This is Lonnie Wong with Fox 40. Having trouble with the hand raise function. Can you hear me?
We can hear you, Lonnie.
Okay. Yeah, I'm curious about the progress on the capital outbreak. Or where are you on that, and how is that being handled?
My apologies, I was on mute. Yes, we are continuing to work with the staff, and we have recommended that they continue to do the testing, mainly for those that are not vaccinated. The measures that we have in place, we believe, will be sufficient to control the outbreak. So we'll continue to monitor for the next couple of weeks and see what happens.
And on a slightly different topic, are there any plans to do more local testing for the variant? You said most of, basically the state, the county testing is not focused on that right now, or doesn't have the ability to do that.
At this time, we are limited by the resources, so that's why we are prioritizing the ones that we send to the state. But once there's more of a capacity to do genotyping, we would definitely like to be able to do more.
But there's no timetable on that.
No timetable at this time.
Thank you.
Chelsea, go ahead.
So I just wanted to, going back to Michael's question of the cases that we're seeing now in the hospitals. I remember Dr. Galley said back in like December or so, it takes about 7 to 14 days before people are in the hospital on average. So I just wanted to make sure that's still kind of the case, kind of the trend that you guys are seeing, like in timeline of progression of disease.
Yes, it is. There's usually a 1 or 2 week lag from the time that you start seeing an increase in cases to the time that you start seeing an increase in hospitalizations. So this does go along with that timeline.
Randy, do you have another question?
Sorry, no.
Well, seeing no additional questions, we will end the briefing with that. I will send you all a recording of this, and it will also be posted on our COVID website. If we are going to have a briefing next week, you can expect an invite in your inbox on Wednesday morning. Thank you all for joining.